One of the interesting things about the EXTRA program is the light it shines on issues facing both the medical profession and the healthcare system. The subject of Dr. Todd Webster's intervention project, electronic medical records, is a clear example of that. By way of background, Dr. Webster is a staff urologist at Grey Bruce Health Services in Owen Sound, Ontario, where he also serves as Chief of Urology and Deputy Chief of Staff. Welcome, Dr. Webster.
Thank you for having me.
I think physicians who are considering applying for the EXTRA program will be interested in knowing why a busy clinician like yourself would tackle the program, which lasts 2 years and includes 6 fairly intensive weeks of training, as well as the completion of a major intervention project. Why did you decide to take the plunge?
It was suggested that I look at considering this, applying for this program, because I was involved in helping out with the computerization process at the hospital. When I looked at what we were trying to accomplish and the fact that I was already being involved, I thought that this program was ideally suited for helping to advance the initiative of computerization, and specifically looking at physician engagement around computerized documentation and computerized order entry. And probably a little bit of it was somewhat selfish in that I felt it would be important for me to be involved in guiding the process of change so that I would know that the end result would be something that I could be happy using.
How hard is it to fit EXTRA into this?
It's been good for me. I think the difficulty is keeping focused on moving the initiative forward between the residency sessions. But the administration and executive at our organization are very supportive, and they are there to help, so that I'm not trying to accomplish it all on my own.
Your intervention project will interest anyone who's been following the evolution of medical record keeping and the move to electronic systems. The goal of your EXTRA project is to implement an electronic medical record system at Grey Bruce Health Services. How are things going so far?
It's going well. The initiative was already underway before I even became involved in the computerization process or implementing an electronic medical record system. So there's been a lot of work that was already done. And my role has been really in helping to prepare for computerized physician order entry, which is really a big step and a paradigm shift in sort of how the physicians work in our workflow processes. So it's been good. I think we've accomplished a lot already and been able to establish a good steering committee. We've got some excellent attendance with clinicians coming out and getting involved, and that's allowed us to find out what things aren't working with the electronic medical record system, and then take that to the HIS department to get things fixed. So we're at this point building a lot of goodwill and trust in that we're engaging the physicians to get them involved.
You said one of your goals is to convince staff of the benefits that will arise because of the switch to electronic records. How have staff responded?
There's certainly a mixed response, and sometimes I can be the soundboard for anything that's not working well. You know, people see me in the OR in the lounge and will tell me the problems they've been having, and I'm not sure if the expectation is that I'll be able to fix them all. But certainly the more people that get involved and the more feedback we get, it does help to develop a system that is usable and will be functional for the physicians.
What about the EXTRA program itself, Dr. Webster? It's obviously a lot different from the clinical work you do day to day. Have there been any surprises, and have you enjoyed this change of pace?
Absolutely, yeah. It's a nice break. Although it's not a holiday per se, it certainly is. It is a change, and I find it very enjoyable because it's a great networking opportunity. I'm learning a lot, and very interesting faculty, and the pager's not going off, the phone's not ringing, I'm not getting pulled in 10 directions at once. I can actually sit and enjoy learning something.
How has the extra program influenced your career and clinical leadership?
I think it definitely is benefiting me in developing my clinical leadership skills. As far as where I take it and what I do and with my career, I guess still remains to be seen.
Dr. Webster, who do you think will benefit most from your participation in the extra program? You or Grey Bruce Health Services?
I think I'd say it'd be 50-50 there, maybe. I think it's a mutually beneficial program for the organizations and for the candidates.
Todd, thanks a lot for coming and speaking with us today. We appreciate it.
Thank you for having me.